Hello class. As you know, we are learning about health assessment, and we're going to talk about some of the principles of health assessment. Health assessment is the first part of nursing process, and it is important because we need to take a very accurate history and assess the patient very, very accurately so that we can make accurate nursing diagnosis and have set accurate goals for the patient. Therefore, today we are going to talk about some of the objectives for today are describe the history-taking process, describe physical assessment, examination of adults and children, describe various diagnostic procedures, and we're also going to talk about some of the skills that are important. As I have said, it is the first stage of the nursing process, and it has to be tailored to individuals because all individuals are different. So therefore, it is very much important that we individualize health assessment. The purpose is to achieve the following. One of the major purposes of health assessment is to gain a baseline for the patient, to know at this point where the patient is in terms of his or her health. This is done on admission or as you meet the patient, be it in the hospital in acute care, or be it in the community, or be it in a clinic. This is where you are going to get a baseline data from the patient. The purpose also includes to supplement and confirm what other information you have. So you may have information from the lab, you may have information from the notes, you may have information from X-rays, etc. So it is to try and confirm or not confirm what you have got. The data also helps you establish a nursing diagnosis, as I have said before. It helps you to evaluate the physiological outcomes of health care. So what have we achieved so far for this patient? And it is also important to help us screen the patient for certain disorders. It helps us also recognize early symptoms of the patient, whether the patient is declining or improving. Yeah? And it helps us to identify risks that the patient may be having. For example, if you take history from a patient, you might find that in this family there is a strong history of breast cancer. Or you may find in this family there is a strong history of abdominal problems. Or you may find that there is a strong history of hypertension, diabetes, or heart diseases in certain families. So it helps you to find out whether your client, your patient is at risk or is not at risk. So you are also screening for other health problems. For example, patients are not themselves sometimes don't screen. And it is not common in our setup for patients to go for screening. So it is an opportunity when you meet the patient in whatever setup to screen for certain problems. So as I have said earlier, to screen for diabetes, hypertension, breast cancer, etc. And it provides an opportunity for you as a nurse to promote health. So for example, if you find this patient has not been doing breast self-examination or testicular self-examination, then you want to teach them and you want to promote why it is important that these patients conduct this examinations on themselves. It helps you to identify actual or potential problems. So for example, when the patient has come to you, they may have come to you with some problem. So for example, the patient has come to you with pain. Pain is an actual problem, okay? But there may be potential problems as well. For example, some patient may be at risk for something, at risk for infection, yeah? Because of their practices, of their behaviors, they may be at risk for certain things, or they may be having actual problems. And through health assessment, you will be able to find out whether the patient has actual problems or is at risk for certain problems. It helps you to develop a care plan which is tailor-made for this particular patient. It is individualized. So therefore, when you take the history from the patient, you will be able to develop a care plan which is specific to this patient. Because a lot of patients may have breast cancer, but their specific needs may be quite different, right? For some person, pain is the biggest worry. But for another person, the feeling that they may die may be overwhelming. So these patients will have different concerns compared. You cannot put them all in one box and say it fits all sizes. Different patients, as you evaluate the patient's needs, you will find that different patients have different needs. Then it also helps you to plan for discharge, because patients are not going to remain in your care and in the hospital forever. So therefore, it helps you to analyze what will life be like for this person when they go home. What are the medications they are going to have to continue with? What are other care practices they will have to continue with as they go home? And can you educate them? Can you facilitate ensuring that this person will continue getting well as they go home? For example, if a patient has a fracture of the femur and they live on the 4th floor, you need to help the patient and the family to understand that when they live on the 4th floor, they are not going to be able to come up and down every time to go shopping, to go to the barber, to go doing other activities of daily living. They are going to need help. And you need to support them and the family to chart out some plan as to how they are going to continue with their care, so that they don't come back to the hospital with complications. So this is a framework of assessment, and in this framework, as you can see, we assess and we have certain key factors. We look at the family, the community, and the environment. We look at the psychosocial, physical, and spiritual aspects of assessing a patient. Now, assessment is systematic and it is continuous, okay? It is done within a very structured process where we collect data, which is continuous, and we communicate the data, the client's data, so that there is continuity. We utilize the nursing process, and as I cannot emphasize enough that this is the first part of nursing process. And it can be initial and it can be ongoing. Initially you get the baseline. Then following that, when you go and collect data again, then it is ongoing. For example, when the patient comes to you, you take a temperature. The temperature is 39 degrees. Then you have done certain interventions. Then you are going to go and take the temperature again. When you take the temperature again, you will find that either it has not changed, so that means whatever you did is not really working, or it has come down, or it has gone up. So it tells you where you are. And there are differences between medical assessment and nursing assessment. Nursing assessment is done so that we can develop a nursing diagnosis or several nursing diagnoses and develop a plan of care which will be followed by the nursing team. So we are going to now go on to talk briefly about the functions of interview and health history. Because as we talk to a patient, as the patient comes to you or you go to the patient at the bedside, the first thing you will be doing is to collect data, to interview the patient and to get information about their illness, what brings them to the hospital, right? It is to establish an initial bond between the nurse and the patient. So we interview the patient. We don't just get into the teeth of it. Yeah? We start with building a rapport, building a bond, so that the patient feels comfortable to give you the information that you require to care for this patient. Okay? And then laying the foundation for subsequent clinical decision making. Because when you collect the data from the patient, it is to help you make clinical decisions and develop a care plan which is to support the patient with his or her recovery. It is also very important because it provides a legal document. Because whatever data you will collect from the patient, you are going to document it. And this documentation is legal. It is going to be legal. It's going to be the legal document of the subjective and objective data that you have collected from the patient during the clinical interview. Subjective data, as we have discussed, is what the person tells you. Objective data is what you get, which is factual, which, for example, when you take a thermometer and take the temperature of the patient, that is objective data. But when the patient tells you, I'm feeling pain, I have a lot of pain, it's unbearable pain, that is subjective, because pain cannot be measured with a thermometer or any stick there, right? So there is that subjective and objective data. And the health history and interview serves as an essential element of peer review process of evaluation. So when we have documented everything, others can come and evaluate how is the care in this particular institution. And that care usually is evaluated through documentation. So therefore, your initial assessment and initial documentation of your assessment is very, very important, because it tells other people how is the care in this institution, is the care that people are getting up to a certain standard. And then we also must ensure, as I've already alluded to, that fulfilling a critical component of the documentation through collecting data and then you document. So interviewing establishes and maintains a relationship with the client, and it is important in building the nurse-patient rapport relationship, of building mutual trust. And remember, when we collect data through the interview process, we have a client-nurse confidentiality bond there as well. We're not going to, if the patient tells you, I don't want you to share what I'm telling you with other people, then so be it, because that is the patient's right, yeah, to privacy, to confidentiality. You cannot go and start telling others what the patient specifically told you that they would not like to share with others. So it is a very privileged position that you are in when you have developed a rapport with the patient and the patient is sharing very confidential and intimate information with you. And then there is also the ethical component to having that relationship with the patient. And this principle of autonomy, as I have just said, that if the client tells you that they would not like you to share something with others, that means that is their right, yeah, of autonomy and of their right to make their own decisions. For example, if the patient tells you that I do not want to go for this operation, although the patient has been advised to go for that operation or for that procedure, it is their right to decide. But on your side, it is important you explain to the patient the consequences of not undergoing that procedure that they have been advised, right? Then the patient must feel involved in their care. Remember, whilst you are the nurse and the client is a patient, you must try to maintain an equal relationship between you and the client. You are in a partnership, right? There should be some equality, right? They must feel involved in their care. They must feel involved in making decisions. You just do not force them to make your other decisions on them. They must be part and parcel of the decision-making process. And sometimes it could be very simple things like the patient needs a bed bath. Then you advise the patient, we need to give you a bed bath. But the patient says, no, right now I want to sleep. I'll have the bed bath in the afternoon. Then you got to respect that the patient has a right to make certain decisions. We must also provide culturally competent care, and therefore we must understand the culture of the patient. We must understand what are their beliefs and values so that we work with them. We work with those cultural values and beliefs so that we provide culturally competent care, so that we are not in conflict with the patient. We are together, we are working together. And there may be certain practices that you do not agree with. However, you need to work around them, you need to work with the patient, so that when you collect data, you will be able to see and to understand where is this patient coming from, in terms of their family, in terms of their risk factors, in terms of their culture, and all this is a package that you are going to utilize to develop their care plan, right? So the characteristics of communication which is successful for collecting data is that you must ensure that the patient and the client or the family feels understood, that you are listening to them. Oftentimes, we are listening, but we are not really listening. Yeah? We are actually not even maintaining eye contact. We are not present there. You may be there physically, but you are not there mentally. And the client can tell that you are not there with the person at that particular time. So therefore, the patient must feel that they are being listened to, they are being heard, right? And if you're giving care to a patient, you are collecting history, you are collecting data, that time that you are with the patient, leave other things behind, be solely with the patient. Listen actively, you know, because that will help you to also understand what the client is not telling you. Because there's a lot the client will tell you, but there's also a lot that you will have to understand, which is in between the lines. So you will have to understand what the client is also not telling you. If you are fully present, if you are listening actively, And there are 4 important characteristics that a nurse must have for you to be able to collect good quality data. One is you must be honest, okay? Honesty is very important. If you tell a client, I want to take history from this time to this time, I'm going to be with you and I'm going to take history. Then you make sure you are there at that time, okay? So that you can build that rapport with the patient. Be honest. You know, at this time, I will not be able to be with you because I will be doing this. Therefore, let's negotiate on what time and how we will be doing your care. Yeah? Then you must be appropriate. Appropriate means that you are not putting things there which are inappropriate. Okay? For example, if this person is a vegetarian, it is inappropriate to tell the patient that they must eat meat because the patient is vegetarian. So whatever care you are planning for this patient and however you're doing things and you are collecting history in preparation of your care plan, you have to be appropriate. In some cultures, there must be a certain space between a male and a female who don't know each other well. Yeah? In some cultures, it is inappropriate for a male nurse to go very close to a female patient. And you need to respect that. So you need to be appropriate, right? Then you must be efficient. Efficiency is very important. The time you are with the patient, it must be utilized efficiently. And you must be flexible. Yeah? As I have said already, that if the patient says that at this time I can't have this being done to me, I would like to be done in the afternoon, you need to be flexible. You move your plan around so that you can accommodate the patient's request. And then there are certain qualities of a good communicator as we take history, as we bond with the patient, as we create a rapport. There are certain aspects, and as I have said, there is respect and there is empathy for the client. So you must be very respectful. Find out from the client, for example, how would they like to be addressed? Sometimes I see when I walk around in the wards, people ask, hey mama, hey guka. You know, this person is as old as your grandfather. How would they like to be addressed? Maybe they would like to be addressed Mr. So-and-so, yeah? Or Baba so-and-so, or Mama so-and-so. Be respectful. Because, remember, one day you will also be in their place. And if you are not teaching them properly, the same will come to you. So you have to be respectful. Yeah? Empathize with the patient. You know, they may be going through a lot of stuff. They are in hospital. Maybe the person is a breadwinner. Maybe they are stressed because their family doesn't even have food to eat. There are other things that they are stressing. Maybe if they are in hospital for so long, they could get sacked from their job. So they have many, many things that are stressing them. So be empathetic. Have good communication skills. Communicate to the patient so that they understand what you are trying to tell them, right? It is not misunderstanding over misunderstanding. If you are trying to make a point A, make sure the patient is understanding that point A. Tolerance of values and beliefs which are different from your own, right? For example, there are people who may be may come from different religions, different cultural backgrounds, and you are from a different cultural background, different religion. You need to understand these people's beliefs and values. You cannot put or push your values on the client. It is not about you. It is about the client. Yeah? You are there because of the client. You are not there because of you. And therefore, you need to understand and appreciate and tolerate differences in diversity. You know, there is strength in diversity. You also need to have unbiased attitudes. Yeah? Don't be biased. You know, sometimes in the report, you say that patient is difficult. There is no patient who is difficult. They are all in difficult circumstances, but there is no one who is difficult. And therefore, don't become biased towards that patient. Don't have stereotypes, right? Because this person has come to you for help. And when we have good communication, good history taking, good history and interview, therefore you will get good information. And that will help you to kind of provide good care. Patience, you know, you need to have patience, an unbiased attitude, which we have already talked about, and awareness of gender issues. As I have already said, there may be certain communities, even in Kenya, we have communities who don't like to be nursed by a male nurse. So you need to respect that, because that is there. It doesn't hurt you in any way to accommodate that, then you need to accommodate it. But for example, if you are in a ward and you are the only male nurse there, which I hope it will never be true, then you need to make them understand you are the one who is going to be able to give them the care, and you are professional. It is your behavior which will help you to achieve your objectives. Yeah? It is how you will also behave. If somebody says something about what they would like or not like, and you become defensive, then that is going to bring conflict. And then we have the client's rights, which we have to understand, and we have to respect, which is right of dignity, right of information. Often patients don't even know what they are suffering from, and which is a big gap. So they have a right to know what information belongs to them in their file. They should be aware of it. They should have, or they have the right to choice. They have a right to privacy. They have a right to confidentiality, continuity of care, and a right of an opinion. Yeah? When they see, I don't think this medicine is working on me, that is their opinion. They may be coming from somewhere when they're telling you that. So we are going to really wind up now with talking very, very briefly about establishing the goals of therapeutic communication, or communication is to establish a therapeutic relationship between the client and the nurse, identify clients' concerns and problems, assess the client's perception of the problem, recognize the client's needs, and guide them towards a satisfying and socially acceptable solution. And these are very, very important goals of when you are communicating with your client, when you are collecting data from the client. And remember, as I have said several times, that in the nursing process, health assessment is the first part of nursing process. And I think I'm going to stop there. Thank you very much for listening. Be safe wherever you are.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then, email all the above to apply@mku.ac.ke.